Once again, guys, you always have to remember, advocate. You know your body better than anyone else, even better than a doctor.
My intestines were so inflamed that they damn near shut completely, a full-on stricture, and that's very dangerous.
Everybody, we are here back again with another vlog, another invisible illness vlog. We have so much to update you guys on. If you guys have not seen our previous vlog in the past, we talk about our insurance that really knocked us down last year and how they just left us high and dry.
Let's put it in lightly.
Yes, so if you want to check that out, definitely we recommend it, because this is a part 2 now. Like, can you even, like, you can't even see him. There he is.
Is he back there?
Like, I was just like, I can't even see him. And you may be wondering, where is baby Sushi? She is with her abuelita. When it comes down to these appointments lately for Paul's health, we really need to be paying a lot of attention and make sure we are absorbing everything. So it can be hard having, you know, a little baby crying in the appointment, so we can't have that. So let us get started and tell you what's been going on, shall we? Or aka Paul.
So guys, it has been a long journey with my Crohn's disease. So to give a quick recap, over a year ago, I was unable to continue my Humira treatment, and that's when my super specialized IBD doctor transitioned me to Stelara. So Stelara is a little self-injection. You just pinch yourself and wah, and then you go.
You guys have seen the vlogs.
And you've seen the vlogs where we explain everything with that. Over the past year, I have told my doctors time and time again, I don't feel good. This is not really working. You can tell if your body is getting better or if it's not, and obviously it's not going to get better one day to the next. This can take weeks to months.
Yeah.
But I kept telling him, it's not working.
Once again, guys, you always have to remember, advocate. You know your body better than anyone else, even better than a doctor. I've had so many people in the past, he doesn't know more than a doctor. That's not what I'm saying. You know your body more better than a doctor. I'm not saying you know more in everything, like, medically wise.
Not intelligence of, or not intelligence, not of like an actual subject of the matter of medicine or anything like that, but you know if something's working or if it's not in your body.
Exactly.
Another quick recap, my super specialized IBD doctor, he left the practice.
Out of nowhere. Out
of nowhere, him and a few doctors left, and they just poof, vanished. They didn't move,
literally vanished.
But they just vanished, and we had no idea what was going on. So then I got left with another doctor who was another IBD specialist, and you know, I had no choice at this point because a regular GI will not take me on.
Yeah. So
we continued with him, and he fell short so many times in so many ways, from him to his staff, the nurses, the medical assistants, all of them.
Let us let you know how bad the staff was. We actually had to drive practically 45 minutes to their office location and, you know, get things resolved, because they were not answering the phone. They would leave Paul on red for like 2 weeks while he's like struggling health-wise and everything. So like maybe 4 or 5 times he had to go down there and be like, I've been calling, I need this, like I need my medication.
Like, imagine I show up to the receptionist, I'm like,
ow,
hey! Like literally, it got to that point.
We had to do whatever we could so Paul could get treatment. So if we have to drive 45 minutes, fine. Even though we called maybe like every single day, 3 times a day, yeah, minimum, nothing. Like, you, when it comes down to your health, you know, you gotta put on your big boy pants and be like, This ain't happening.
And you can't rely on them, especially an office that's that unreliable.
Yeah.
Because this is my health, and they're not gonna really care if I don't feel good, because they don't care. You know what I mean?
It's not their body.
Exactly.
Now, what really irked me at one point was that, of course, once his old doctor left, they, you know, they transferred Paul to this new doctor. They said pretty much Paul was like a new patient at that point, and he couldn't be seen until like 3 weeks or 3 months.
And I
was furious.
Mind you, I needed to see a doctor.
He's in a flare-up.
Yeah.
And they're like, there's nothing we can do, sorry. And we just couldn't find a lot of you guys are gonna ask, why didn't you find another doctor? Once again, Paul's Crohn's has gotten to a place that he needs to see somebody specialized. So no regular GI is gonna see them. So at this point, they were telling us, well, maybe you could go to Shands, and that's like 4 hours away from us.
Or Mayo Clinic.
Yeah, and that's 3.5 hours away from us. And I'm just like, I told Paul, if that's an option, let's do it. But Paul's like, I'm getting weaker and weaker each and every day. I feel sick. He's like, I don't know if I can even make that type of drive.
And here's the best part. I actually called a specialized GI doctor in Gainesville at the university.
Yes.
And they wouldn't take my insurance. And I understand that. They wouldn't take it. I was like, that's perfectly fine. I'll pay cash for the appointments. And they're like, oh no, we can't do that. And I was like, what do you mean you can't? Dude, like, you tell me it's $300 to see the doctor. I will swipe my little card and pay you $300 to see the doctor. I don't mind that, because I was like, I'm that desperate that I will pay hundreds of dollars every single time I have to see a doctor to get treatment. I was like, I'm fine with that. Oh no, we can't accept that. And I was like, you do understand this is the best deal you could get. You tell me $300, I'll pay $300, even $500 I was willing to pay, because that's how desperate I was. So since that got
X'd out. They said they wouldn't
very
see him.
fast. I was like, you know what? Screw it. I can't do it. I can't drive 4 hours to a doctor's, you know?
So we had to wait the 3 months, and we were on the cancellation list.
Yeah.
I don't even think, exactly, I don't even think it existed.
As time went on with my Stellar, and like we said, I kept telling my doctor I'm not feeling good, I started to get progressively worse and worse. So it was kind of like a non-stop flare for months.
Yeah.
And it was something that I was going to the bathroom maybe 10 times a day. Horrible pain, agony, cramping, anything, like, you know, it's not just, oh, it's a tummy ache. No, it affects you in every single way that you can possibly imagine. I have zero energy. I wake up, I slept 12 hours, I wake up and I feel like I just ran a marathon, and you just can't get a break.
What really got to me to know that Paul was really in a bad state or in a bad flare-up was one day I walked in, he didn't flush the toilet, and all I saw was just blood. And I was very concerned. I was just like, do you need a pad? Do you need a tampon? Like, what is this? Another thing I want to bring up, a lot of people have asked, like, where have you guys been? With Paul's flare-up, and then him needing to go into the hospital, having a newborn, I just couldn't, honestly guys, I couldn't record, I couldn't post, I couldn't keep up with social media, because at that point I had to take care of Paul. I have to take care of his health, help him relax, not be stressed, because stress does make his Crohn's 20 times worse. And at the same time I had to take care of a newborn. You know, there was a lot to juggle. So please, once again guys, give us time. We're still trying to get things resolved.
And don't get me wrong, it's not that I take the back seat on raising our daughter and taking care of her. No, I am doing everything just as the same, but you know, the amount of energy I have to use it wisely.
Yeah.
You know, so I use that energy on my daughter and on Janice, and there you go. I don't want to waste it on, you know, doing a bunch of other different things that don't necessarily take precedence over my health, my daughter, and my wife. You know, at one point I got so bad, I literally sat with my doctor and I said, listen, you need to do something. This is not okay. Finally, he was like, okay, let's do a colonoscopy and see what's going on.
But before that, the past several appointments, Paul would go in there. Can we change treatment? Oh, no, you're fine.
just wait, give it time, the medication needs time to work. And I'm like, it's been 7-8 months. If it's not really working, it's not gonna work magically after a year.
And then so Paul went into another appointment, and he's just like doing his research. He's like, what about all natural? Let's do this.
Like diet changes, supplements, things that promote naturally anti-inflammatory properties. And he's like, no, none of that's gonna work. You just need medication.
Yeah.
And I'm just like, these things do work, and I just need a little bit of guidance as to what to do. Exactly. And this doctor just straight up shot me down super fast.
He's like, natural doesn't do anything for anybody.
Pretty much. So finally, he agreed to do a colon and endoscopy, and I was like,
and that's Paul being on him. Like,
yes.
I need this. There's something wrong. Please check me out.
Yes.
And Paul's not the type of person to say, hey, I want to do a colon and endoscopy, because we all know in the past, if you guys seen our vlogs with his Crohn's, and if you guys want to check that out, check out his Crohn's disease playlist. You see that he hates the prep. The prep does not do so good for him. So if Paul, in a sense, in the past, if he could try to avoid it, he would. So for him to go into an appointment and was like, do it, I need this, check me out. Exactly.
So finally, the doctor agreed, got the procedure done, got out, and then the doctor told me, hey, upper looks fine, looks normal, nothing crazy, anything concerning. Lower half
is concerning.
Is very concerning. So it was to the point that I have majority of my inflammation is on my colon, not in my small intestines. So what happened is that they already knew where to kind of look, and this time they couldn't even look.
Nope.
Why? My intestines were so inflamed that they damn near shut completely, a full-on stricture, and that's very dangerous.
Very.
And the doctor told me, he's like, you need to go see a colorectal surgeon immediately and be on the lookout, because at any point in time, if this stricture completely shuts, I have to have my colon removed permanently. So after shedding one of many tears, Alright guys, so it's a little bit further in the day. Needless to say, this doctor's appointment was a little emotional for both Janice and I. And, you know, it's crazy to think how bad my health has gotten and how far it could still go. I'm not at my worst. I'm not at my worst, but I can get there pretty dang quick from where I'm at right now. So my doctor discussed with me, you know, there's two big possibilities, and he's leaning more towards one of them. Possibility number one is I have the severe inflammation, and switching over to different drugs, you know, that would have brought the inflammation down, but it still really hasn't. So the question number two is it that the drug's not working, or is it that this is not inflammation, that this is scar tissue? And if it's scar tissue, no medication is going to make it go away because it's a scar. And the only solution is surgery. Now, I don't want to have surgery if I can avoid it, obviously, but it's you know, it's in the back of my mind now, and it really hit me. I was like, good Lord have mercy that this is the point where I'm at, that, you know, I've been on multiple medications. I've taken millions of dollars of medicine, and, you know, some of them helped, some of them didn't, and now we're faced with a dilemma of what is my next step. And yeah, I have been referred to go see a colon and rectal surgeon, so a specialized one, and that most likely surgery will be needed. Now, as far as the extent of the surgery, we don't know. That's something that the colon rectal surgeon is going to determine, see some of my, you know, my colonoscopies, and possibly order some new imaging to see, you know, him get a baseline to see where I'm at and figure out what he wants to do. So Unfortunately, this vlog is going to end on a not so positive note, but I have to stay positive throughout all of this because at the end of the day, this is my health and I have to do what I have to do to ensure that my daughter has the best life possible, that me and my wife have the best life possible. And I'll be honest with you, the way how I'm feeling right now, you know, if surgery can make all these feelings go away, it you know, it's not a bad thing per se, you know what I mean? Because many of you know, have seen me struggle with Crohn's. I have lost a lot of weight. I don't feel good. I am tired. I don't have energy to do basic things. And, you know, life kicks me down a lot harder than most people. And some people just look at me like, oh, you're so young. You should be fine. Thing is invisible illness. It sucks, doesn't it? Overall, you know, is it a positive outcome? Maybe. But, you know, a little bit on the sadder side because now we have some new steps that we have to take as far as what we are going to do. So yeah, guys, that's pretty much it for this vlog. And, you know, if you guys have any words of advice, things to do, please comment down below. And yeah, guys, thank you so much for all the love and support. We truly appreciate it. Check the links in the description below for our other forms of social media. Do not forget, guys, to like, share, and subscribe. It means a lot to us. It helps our channel grow, and what our channel growing does is we get to spread awareness to as many more people as possible. And that's our biggest goal, is we want to touch as many people's lives as possible. We've helped a lot of people. People have said it, like, you have helped me, you've given me ideas, and that makes all of this worth it, all of this work, all of this journey, because, you know, it's very easy to not record and not put our lives out there. We do it for you guys, and I want to say thank you so much. So guys, for now, adieu and good night.